1 in every 4 couples in developing countries are affected by infertility. According to the World Health Organization, it remains a burden because of the myths and misconceptions associated with the issue. Today on Sound Health, we are looking at the prevalence of infertility in Nigeria. I'm Olasumbo Mudupe. Welcome to Sound Health. On innovation this week, researchers come up with self-administered human papilloma virus test. That's in a moment. Sound Health continues shortly. Please stay with us.
Families are an integral part of any society. They hold societies together, and intergenerational relationships extend these legacies over time. The family has the responsibility to protect, raise, and nurture children. As easy as it sounds, it remains a challenge for some as they experience difficulty in conceiving and nurturing their own. A major factor in this is infertility. According to United Nations Population Fund, it is now a growing problem in Nigeria, affecting about 25% of the country's population. Medical experts say infertility is a considerable obstacle for women wishing to make a family and occurs when a poor reproductive system impairs the ability of the body to perform necessary functions of reproduction. The phase could be emotional and at the same time psychological for the affected.
Now let's discuss this further. Joining me now is a consultant gynecologist with the Bridge Clinic. He's Dr. Ibrahim. Welcome to the program, Doctor.
Yeah, it's a pleasure. Thank you. Nice to be here as well.
Okay. Are there side effects from the two treatments? You mentioned the
IUI and the
IUI.
Well, in medical parlance, there is no procedure that does not have its own risk. Even I'm sure when you open your leaflet of paracetamol, you probably want to think twice, before using the paracetamol. But the truth is that you rarely have some of these things happening. So IVF, IUI also has its own risks as well. And these risks are also made worse if these procedures are not properly done and are not done by well-qualified professionals, as it were. So basically in IVF, what do we do or what is done? IVF basically aims, to overcome tubal problems. So the fallopian tubes, is like the conduit pipe through which the sperm and the eggs meet and where fertilization happens. And where that is blocked, you understand? Of course, it creates a problem for fertility. So IVF just tries to overcome that. Yeah, that's why I said earlier that we don't do surgeries again. You try and correct tubal problems. You understand? It's not advised, anymore. So basically, in IVF, so what is done is that the woman is put on some medications at a particular period of time during her menstrual cycle, and the aim of these medications is to ensure that she produces a reasonable amount of eggs. Because if it's not properly done, she could also produce abnormally unreasonable number of eggs. So it's properly done, she's expected to produce a reasonable number of eggs. Now, these eggs are monitored, and at an appropriate time, they are collected from the woman through, a specific procedure which we call egg collection or ultrasound-directed follicular aspiration. Now, when those eggs are collected, they are then fertilized with the husband's sperm. The embryos are cultured for a period of time, usually 3 to 5 days, depending on the center. For some centers, they do it in 3 days. For some centers, 5 days. At the end of which the embryos are now transferred, into the woman. So anyway, along this line, there could be complications. First, from the drugs that are used, you could have headaches, lightheadedness, fainting spells, irritability. You understand? From the procedures, that is the process of collecting the eggs, because there is no, is a surgical procedure, so there are complications. You could have bleeding, you could have infection, as it were. Perhaps the most feared of all, for the IVF is what we call ovarian hyperstimulation syndrome. that is in the situation where you're expecting the woman to produce a reasonable number of eggs, and all of a sudden, for whatever reason, either because you did not monitor your drug dosing well, or because of idiosyncrasies of that particular individual, she starts producing eggs beyond your expected or anticipated anticipation, and that creates a problem. You understand? So, and the OHSS could be mild, it could be moderate, it could also be severe, and the severe could also be life threatening as well. Basically, for the IUI, the most important thing or the critical thing about the IUI, because what IUI simply means is that you are giving the woman medications to induce ovulation, that is for her to produce eggs. But the difference between an IUI and IVF is that usually in an IUI, you don't want the woman to produce more than 2 or 3 eggs at the most, preferably 2, but worst case scenario 3. But in an IVF, you are aiming for an average of about 12 to 15. You can see the difference. You're aiming for about 12 to 15. But in an IUI, you are hoping for 2. Worst case scenario, 3. And then at an appropriate time, when you think she's about to ovulate, you now prepare the sperms of the husband, and then you inject it. It's like a kind of indirect sexual relations, if I may put it that way. But the aim is that it usually helps to deposit the sperm as close as possible, to where fertilization is going to happen. So where the sperms are not properly prepared, because the essence of doing an IUI is to prepare the sperm so that as much impurity, in quotes, if I put it that way, are sieved out or removed from the sperm. So if that is not properly done and then insemination is done, it could really give the woman very severe, crampy, lower abdominal pains. You understand? Which could necessitate hospital admission. And on top of that, you could also have infection, as it were, if all these processes are not properly done.
The process could be psychological and at the same time emotional. How have you been able to manage this in patients?
It's more emotionally traumatizing, particularly for the woman, because usually not all women also have adequate support, support in terms of, family, people being around her. Rather, what you have is situations where, people are even putting pressure on the woman. I mean, why have you not given us our grandchild? Why have you not done this? Why have you not done that? Whereas the problem, might not be residing, with her. So these are the issues. And then these issues are very important, perhaps more important than the treatment process. Because if you don't have a psychologically stable woman, whatever treatment interventions they are going to do, the chances of working or succeeding, is significantly reduced, as well. So that is one thing that needs, to be, well addressed and taken care of. And for various centers, more often than not, the doctors, serve as the first line of counseling. Then you have the nurses, and then in a number of centers, you also have trained counselors, who will help, to support, whatever the doctors or the nurses, might have done. So it's quite critical. It's very important. Fertility-related challenges could be emotionally traumatizing, and every clinic, that is involved in handling fertility-related problems needs to be prepared for these emotional challenges.
What is the risk and perhaps the success rate? If a cycle fails, when should the patient continue or restart? Can a patient restart the process immediately?
You've kind of narrowed me down.
Because I have a friend, I can't remember if she did IVF or IUI about 2 or 3 months ago. She has started, she's looking for another hospital to start all over again.
Yeah, because when you talk about being failure, like I said, that means we're probably already looking at an IVF.
Yes.
You understand? Because the process of the IVF, itself, apart from the problem of fertility, is also emotionally challenging, because the woman has to be on injections, for a considerable, period of time, as it were, and that has its own emotional challenges as well. Now, this is even made worse, you understand, when that cycle fails, because the truth again is that it's not all the time that the cycle fails, that there are specific reasons that can be adduced as to why that cycle failed. You understand? Now, for many of the clients who have undergone these processes, some of them are lucky. When I say lucky in terms of, having, excess embryos, you understand, that can be kept for them. You understand? So that when those excess embryos are kept for them, should that cycle fail, then it's a lot easier, for them to start all over again, because this time around they don't have to go through the whole IVF process again. Their womb is just prepared to receive the embryos that had already been kept for them, from the previous cycle. More importantly, for what the major determining factor as to the time that the woman recommences or reattempts again, because the truth is, for some people, in the absence of miracles, their only realistic chance of being able to achieve conception is through IVF. You understand? For some people. So even when it fails, the only option they have is to gather themselves together and have a go at it again. Because the fact that it didn't work the first time doesn't mean that it's not going to work the second time. So that is the thing about IVF. So what determines, more importantly, when a woman attempts starting again, takes me back to the psychological state of mind. You understand? As soon as the woman feels she's psychologically, stable and ready, you understand, to commence another cycle. It's not that there's a specific period, because you can't assign a specific period without taking into cognizance the psychological state, you understand, of the woman. But now, assuming that after a cycle, you understand, the woman is deemed to be psychologically stable and she's ready to go again, she could actually start as soon as after her next normal menstrual period, after that failed cycle. But for a number of women, it usually takes a while, to gather themselves, together, you understand, to have a go at it again. And then particularly when we also look at the investment in terms of the financial capacity, or the financial investment, that is involved in the whole process of IVF, because IVF doesn't come cheap, in all honesty.
Okay. We've had cases where patients or members of the public will tell you, once I go on IVF, there's every probability I'll give birth to twins, triplets. So there's this societal belief. Is this true?
It is not true. It is not true. And then the reason why I say that is that ultimately, you understand, it's only God, that knows the number of children that you're going to have. It's only God that even knows whether the IVF is going to work or not. But one thing that we are sure of is that the number of embryos that are transferred, you understand, does not necessarily determine pregnancy or the outcome, if I may put it that way. You understand? It doesn't in any way whatsoever. You can transfer 4 and still not get pregnant. You can transfer 4 and end up with twin. So because we still have a bit of a regulatory challenges in the country, different clinics try to adapt what they think is best for them. For some clinics, they don't transfer more than 2. For some clinics, they transfer up to 3. For some clinics, they transfer up to 4. You understand? But generally world over, particularly Europe and then other developed countries of the world, the emphasis is tending towards a single embryo transfer, because for them over there, twinning or multiple or higher order pregnancy is a big issue for them as compared to what we have in our own environment. But at the same time, we should not put our women at the risks and complications that could arise from multiple pregnancy in the process of getting them pregnant.
What's your advice to members of the public? Is there hope of being fertile again?
Going through that beautiful. There is a lot of hope out there, and that is also the beauty of the IVF that we have. Because with IVF now, the truth is that it's possible to get anybody pregnant, and I'm sure you'd have seen also in the pages of newspaper, where you have a 50-something-year-old woman giving birth. Even in some cases, 65, 67 a year-old woman, giving birth. This can only be possible, with an IVF. Though I must also state that, different clinics also try to adopt. For some clinics, once a woman is above a particular age limit, they don't offer treatment. Because it's not just about the child. You also have to consider, the care of that child. But we have reported instances where you have 67, 68 and above year old women, giving birth. This can only be possible because of IVF. So it's possible to get anybody pregnant as long as one is alive, irrespective of the diagnosis or whatever. You understand? There is hope. The most important thing is for individuals that are affected by this problem to seek appropriate help. First, they have to believe. You understand? Then they have to seek appropriate medical counseling. Seek or go to well-recognized clinics. You understand, as it were, and avail themselves of whatever treatment options that their doctors, you understand, prescribe or recommend for them. But there is a lot of hope, out there, and even with the IVF, there are a lot of other interventions, that are in place. So the critical thing is that for our women out there who are having fertility-related challenges, please do not despair, do not lose hope. There is a lot of hope. The most important thing is for you to arm yourself with the right information, because that is a very critical tool that you need. Knowledge, they say, is power. And once you've armed yourself with the appropriate knowledge and information, go out there and do the needful.
Okay, thank you so much for sharing your expertise with viewers.
Yeah, it's been a pleasure, and I hope following this interview, one or two women out there have been inspired and then are ready, to take the next step towards solving their fertility-related challenges. Thank you, and I look forward to being on this program sometime soon again.
You're welcome.
It's a pleasure.
Okay, that was Dr. Ibrahim, a consultant gynecologist with the Bridge Clinic, and we have been discussing the prevalence of infertility in Nigeria. Soundhealth continues with trending and home essentials. Please stay with us. It's still Sound Health on Lagos Television. On Innovation this week, researchers showcase self-administered human papillomavirus test. That's in a moment. Please stay with us.
Self-administered HPV test.
Human papillomavirus, HPV, infects nearly 80% of sexually active women. Medical screenings are vital to detect certain strains of cervical cancer linked to HPV. The virus causes over 250,000 deaths from cervical cancer a year. Nearly 85% of these deaths are in third world countries, where access to healthcare screenings is very low, if at all available. Strategies are needed to test and treat everyone, regardless of geography. Scientists have developed self-administered HPV test kits that include a swab and a test tube or mail-in box. The idea is that tests can be delivered to communities everywhere for women to administer their own test and send a sample back to a lab. By offering a greater number of women simple and accurate screenings for cervical cancer, self-administered HPV tests can save money and lives all over the world.
That's it on Sound Health this week. Hope you've learned a few things on the program today. For comments and inquiries, please send SMS on 0818-815-3695 or follow us on social media at LTV Social, #Sound Health. A sound health is a sound mind. Make healthy living your choice.